Welcome back to Open Line tonight. If you are just joining us here on the half hour, we are talking about the Affordable Care Act and the deadline to sign up, which is this Saturday at midnight. If you have questions, if you're in a quandary of what you need to do, now is the time to call. I have two wonderful experts here joining me. I haven't heard a question yet that has stumped them. So Tony Garr with the Tennessee Healthcare Campaign and Mary Moore with Family and Children Services. Thank you all again for being here. Our number is 615-737-PLUS. That's the number to call right now. Here's another number that I want you to write down, and we're going to put it on the screen here very soon. 844-644-5443. There it is on the screen right there. That is the number to call that will hook you up with a navigator that will explain this entire process, even walk you through it. If you could explain again for folks just joining us, what happens when you call that number?
And we really need people to leave their name and phone number.
Got to do a message.
Yes, they got to do a message. We actually pick up their number, but if they would leave their name in a short message, that would be helpful. And what that number does is we have a whole slew of volunteers who are answering those calls, returning those calls, and the volunteers, as they are answering or as they're returning those calls, they have an electronic calendar in front of them with the schedules of all the navigators in all the libraries who can do phone interviews as well as face-to-face interviews. And then we will sort of say, well, at Green Hills Library on Friday at 4 o'clock, does that time work for you? And we will put their name and their cell phone number and their email address, and we'll say scheduled, and then her navigator will get the appointment. They will get actually a text message that will reinforce that, and then 24 hours before then they'll get another text message to remind them. So we've got this whole system that sort of connects them to a navigator so that they can get the best service they can get.
And you can get a face-to-face appointment. Somebody can walk you through this over the phone, actually get with you online and help you sign up. Can't make the decision for you. You do have to make your own decision.
That's the only thing we can do.
But you can walk alongside them and answer all the questions that they may have. This is such a fantastic service. Is it free?
Yes.
Yes.
Thank goodness, right? We love free stuff.
Yes, that's a very good point. I'm glad you brought that up. So it's completely free, and what that also means is that we don't work on a commission basis, so there's absolutely no pressure. So you have nothing to lose. If you check out your options, if you decide it's really not for you, no pressure.
No problem.
Okay, no one's going to be calling you every day, asking you to commit, finalize your plan. So really, it's no pressure, win-win situation.
Now, we did mention the deadline is Saturday at midnight. So no signing up after that. What if I lose my job this year?
Oh, good question. Good question. If they lose their job anytime during the coming year and they had insurance through their job, they're going to be offered COBRA. But most people don't know this, and so I'm glad you asked the question. Actually, they also have the option of going to the ACA as opposed to taking COBRA.
Because it can be very expensive.
Generally speaking, COBRA is a lot more expensive than the ACA. So an ACA option will actually be cheaper for them in most occasions. The other, and if a person currently is on COBRA, there's 2 times when you can, well, there's 3 times when you cannot choose COBRA. When you're first offered it, you can go to the ACA as opposed to COBRA. During open enrollment period, you can drop your COBRA coverage and get to the ACA. And of course, when your COBRA ends 18 months later, then you can also get on the ACA. So the whole idea is there would be no break in coverage, and the coverage would be continuous.
You don't want to have that gap, because what if something happens during that gap? Then you are really not covered. The deadline is coming up very quickly. Are you guys in a crunch to set up these appointments?
Well, we're sort of working overtime, and all the volunteers and all the staff know that. I suppose you know, we're probably working more 12-hour days as opposed, and this is both for volunteers as well as staff. We got some, we've got some very, like Mary mentioned earlier, most of her navigators have been here since day one. So they've got 6 years of experience of how to help people think about their plans and how to get people enrolled. And many of the volunteers also have been volunteering for 4 or 5 years. So.
Wow. And over the course of Obamacare, Affordable Care Act, whatever you want to call it, if people are becoming more familiar with it, they're like, oh yeah, I got my plan, is it worthwhile to review that plan every year?
Yeah.
Yes, very much so. So it's very important, I think, to go back every year and look at the options, especially if your income has changed at all, if your job has changed, just to check back and update the information in your application to make sure that you're working on the most current information.
And do the plans substantially change every year when it comes to premiums or deductibles? Are you seeing big swings, or is it pretty standard?
Oh boy.
In a way, there are swings in between the different plans, because when new plans come in, that's always a little bit of a market disruptor. Sure. But for most people who are receiving financial assistance, the financial assistance is based on a percentage of their income. So that kind of standardizes things and keeps there from being just huge, dramatic changes in costs, wouldn't you say, Tony?
Yeah, I would, but also I think we've seen that many times the carriers, and we have Bright Health and Oscar and Cigna here in Middle Tennessee, they send out letters to their people who have enrolled with them, and they go through a process of auto enroll, so they can automatically enroll in that. But we have found that many of those letters actually had some wrong data, or the information was wrong, and so we're really glad when people sort of check with us, because we actually go to the marketplace where the real prices are, so we can help them do that. So some of those earlier letters had wrong information, so please
what if somebody
call.
said, yeah, I checked the box, just re-enroll me? Is this another time where you can go back and double check and change, or no?
Right now you can change.
Okay.
Until December 15th, you can completely change plans.
Okay.
Now, even after December 15th, as long as you're enrolled in a plan, you can make some small changes. Like Tony was saying, you can make changes to your income.
Okay, right.
So if that information has changed, you can still update that past December 15th. And that could affect the price that you're paying. But you're still in that one plan that you've chosen.
Right. Okay. Let's head back to the phone lines. We have Steve, I do believe, on the phone. Hi, Steve. Thanks for calling in. What's your question?
I got a question. I make relatively under $20,000 a year, and I'm soon to be divorced. And my spouse has got the insurance now, and I'll be losing insurance.
Okay.
We speak to a lot of people that are in these life transitions. So December 15th is the deadline for open enrollment, but if you still have coverage right now, and maybe your coverage isn't ending until the end of December or the end of January, that would be another one of those life changes where you can enroll at that point. So if you still have coverage right now, there's no big rush for you to enroll by December 15th. It would just be ahead of whenever your plan is ending.
So let's say Steve's insurance is going to stop when the divorce is finalized on January 30th of 2019. How does he, when and how does he go about then finding his own insurance?
So up to 60 days beforehand, he can go ahead and go in and do the application and look at plans. And then he can select the plan to start the next day after he knows he's going to lose coverage. Okay. So even right now, we could help him. This week's a little hectic, so we might say, since you don't have to sign up by December 15th, we'll call you next week. Yeah. But technically, you have 60 days before you're losing coverage to go on and look at your plans.
Sometimes you never, go ahead.
And he also has 60 days after he loses coverage.
That's what I was going to ask. Okay.
So he can actually enroll, like if his plan ends on the end of January, he actually has to the end of March to sign up for an ACA plan.
Okay. So Steve, it sounds like you're going to want to keep that 844 number handy. That is active all year round. Okay. And that will really be your key to signing up. And Steve was saying he makes $20,000 a year. You all were telling me that a lot of times people will write off signing up for insurance. They just don't think they can afford it from the get-go. But many people are surprised once they actually sit down with somebody.
Oh, they are. They really are. And so we'd ask Steve what his age is, and we know he's making about $20,000. We'd also, depending on what part of Tennessee he lives in, because if you live in Chattanooga, you actually could sign up for Blue Cross Blue Shield, but they're not in Middle Tennessee. So depending on where they live and what their age is and their income, we can sort of tell him what's available for him. So you know, we can And he's likely eligible for premium tax credits. So
I think I read 8 out of 10 people who apply are eligible for tax credits.
Yeah.
And that will take money off your premium.
Yes.
Oh, yes. It really will.
That is fantastic. What do people say, I'm really hooked to this doctor, or I really like this healthcare system? Is that something that can be checked before signing up?
Yeah.
We highly recommend it.
Yes, we do.
And that's something that we can help folks with as well. So one thing they can do is we can help them search online through the carrier's website if their doctor's in network. Also recommend people to call their doctor if there's ever a doubt or a question beforehand. And one thing when they're calling their doctor would be to have the name of the exact insurance company. So not general, do you take marketplace plans or do you take the Affordable Care Act plans, but to have the name of the company. As Tony mentioned, in Middle Tennessee we have Cigna, Bright, and Oscar. So to ask the doctor that question specifically. So we can check that. We also can let them know at the point of enrollment what hospital systems are associated with their plan. So some of the plans cover all the hospitals. Some of them only cover TriStar, for example. So they would be limited to those hospitals.
And it's always good to know before you have an emergency and show up at the wrong door, then you're penalized.
Well, emergencies are covered. You know, you want to go to the nearest hospital in emergency, and that's covered. So that's an exception. You don't have to be in your network if you have an emergency. But it could be that as a result of the emergency, you're going to have surgery 2 weeks later. Then you'll probably have to go to your in-network hospital.
Makes sense. Okay, we have to take another quick break. More of your phone calls right after this. Stay with us.